Hi guys, this is Harsha again and welcome back to my channel Mommy Hub. Today's topic of our discussion is diet and nutrition. I am not nutritionist, even I am not a doctor, but when I was pregnant, I came across a lot of information from internet, books, friends, family and my doctor as well. So I am going to share first of all the do's and don'ts about the diet, then will tell you the diet that I have followed in my pregnancy. Firstly, I would like to clear your mind. It's a misconception that eating a well in your pregnancy means eating for two or eating a lot. So I would suggest if you start off your pregnancy at a healthy weight, then you really don't need to add extra calories in your first trimester. You will need 340 extra calories in your second trimester and 450 calories in last trimester, that is the third trimester. And second point is start taking prenatal vitamin. As I have earlier discussed in my previous video, it's really not possible for you to get all the nutritions from just diet. So it's a better idea to choose your prenatal vitamin, but just make sure that it contains the folic acid and iron, because the deficiency of the folic acid is directly linked with neural to birth defects. And the third point is ask your healthcare provider about deficiency if you are having, so that you can add any other supplements in your diet. And another most important nutrient is the choline. Usually it's not present in prenatal vitamin, but recently the studies has shown that the deficiency of choline also is linked with birth defects. So it's a really good choice to add the choline in your diet. So the sources of the choline are the milk, broccoli, peanut butter, peanuts. So these are the popular vegetarian sources, and even you can get from seafood, shrimps, then scallops, pink salmon, and fourth point is uh, do not diet in your pregnancy, because it's really not a good idea to diet in your pregnancy, because you don't want to suffer your baby from lack of nutrients and vitamins. And the fourth point is most of the women may wonder that how much of the weight should I gain in my pregnancy. So for those, if your BMI is within the range, that is between 25 to 29.9, then you can gain a weight up to 15 to 25 pound of weight. And if your BMI is more than 30, then definitely you are overweight. Then you can gain your 11 to 20 pound of weight in your complete pregnancy. And along with that, I would suggest is start eating small meals frequently, because your baby is taking a huge space in your stomach. So it's really not easy for women to have food at a time. So just divide your meals in a different parts and start having frequent meals. So these are all about the do's. Now I would like to share about don'ts. So there is a list of the food material that you should avoid in your pregnancy. So the first one is the caffeine. Actually there is a conflict about the caffeine, but why would we want to take any risk in such a crucial period? So it's good to skip that caffeine from your diet, or you can limit your intake of caffeine. And the second is alcohol. You really have to give up on alcohol, because studies also have shown that by taking alcohol in your pregnancy may lead to physical and emotional birth defects. So you really have to give up the alcohol during your pregnancy. And then third is so many fishes. Actually almost all the fishes contains methyl mercury metal. So this is a metal believed to be harmful for a baby, so it's a good choice to avoid fish also. But I guess you can have a salmon fish, and you need to skip the cheese, soft cheese, Mexican cheese, and also unpasteurized milk. So this is a kind of bacteria present in those items, so that it really can affect your baby. So it's a good choice to skip all those things from your diet. Come to the diet plan that I have followed in my pregnancy. So first thing in the morning was taking a glass of lukewarm water, and after that I was taking a panchamrut. It really helps to keep the energy level up in the pregnancy. Then was having my breakfast, but I was making sure to add a fruit and a milk with a protein powder, because it's really necessary to increase your protein intake in the pregnancy. And also was taking my prenatal vitamins along with my breakfast. Then comes the lunch. So in lunch I was including veg, chapati, dal, rice, yogurt. Then comes the dinner. So I was keeping my dinner really light because I was facing a problem of acidity in my pregnancy. And in dinner I was including items like dal khichdi, dalia, then salad. So they are really easy to digest food. In between the meals I was snacking on lotus seed or the makhana, roasted grams, then rice, puffed rice or popcorn. So these are all the healthy snack. And definitely I had my cheat days also, and those cheat days I were using to hog the food that I crave for. I hope the information in this video is really helpful to you. So we'll be back soon with the next video. Till then, take care and bye bye.